Hey folks, Dr. Jeff Williams with Creekstone Integrated Care right here in beautiful Amarillo, Texas. I'm coming to you with another video this week, and this one is called What's Better for Back or Neck Pain? Chiropractic, massage, or acupuncture? So we get questions all of the time, as I'm sure you can imagine. One of the most common is the one asking which service would be best for a person's specific pain. Now, we all know that money doesn't grow on trees, so we want to spend our hard-earned dollars on the thing that will make the most impact on getting rid of our complaint. This is so understandable, and with this question in mind, I thought I would go through 3 of the most impactful services available at many chiropractic offices. I'm a chiropractor, so it makes sense to start with chiropractic care. I'm not sure this can be discussed completely without bias, but I think I can come pretty close since here at my clinic, Creekstone in Amarillo, we offer all 3 services. So chiropractic care, let's start there. I think it's important to note that chiropractic is a profession. It is not a form of treatment. It's not something you do. It's not a technique. Chiropractic is a profession. And for many, there's a perception that chiropractic just means moving or popping bones, and I'm here to tell you that that could not be further from the truth. Under the chiropractic profession, or the chiropractic umbrella, falls many services a licensed chiropractor is able to perform. And some of these services include spinal manipulative therapy. That's what we're known for, right? Adjustments, addressing movement issues. That's what chiropractors do. We're great with short-term pain relief, but we're also wonderful with chronic pain syndrome or long-term, long-lasting pain. We commonly do non-surgical spinal decompression, which is amazing for disc herniations, disc issues, pain, numbness, tingling into limbs, anything like that. We do exercise rehab, which is very, very much like physical therapy, if not identical. Then we do myofascial or muscle work, which is similar to massage, but not as intensive, not as time intensive, as most chiropractors don't have the opportunity to spend 30 minutes to an hour with a patient like a massage therapist could. So it is very similar to massage, but not nearly as intensive. Then we have proprioceptive training. Low-level laser, also known as cold laser therapy, which is great for joint pain, inflammation of any kind, and really quicker healing of injuries. Therapeutic modalities like electric stim and ultrasound, postural studies and recommendations, movement studies and recommendations, balance training, biomechanical training, and even acupuncture. Now, acupuncture, which we'll talk more about here in a second, can be done by chiropractors that choose to get that very specific training and certification. A chiropractor has to go to an extra 100 hours of training and pass the test and all that good stuff to actually do acupuncture in their office themselves. So as you can see, going to an evidence-based, top-of-their-game chiropractor can be a real game changer for regular musculoskeletal pain. A high-level chiropractor can integrate several techniques and several ideas to treat pain from all different directions and really make a huge impact on a patient's pain, no matter how long the pain has persisted. And man, that is exciting, folks. That's exciting. It is especially exciting when you know that the American population has been led to believe over the course of generations that pain can be treated simply through pills, shots, or surgery. But when we look at the opioid crisis, the fact that people are dying, last year 74,000 people died of opioid-related overdoses. And then each year 103,000 people go to the hospital and 16,500 people die every year from taking simple over-the-counter ibuprofen and Tylenol. Okay, there's issues with that kind of thinking. Combine that with the ineffectiveness of the research literature for most spinal surgeries for chronic pain. Well, I, for one, find it exhilarating and extremely exciting that chiropractors can help in a completely non-invasive, safe, non-pharmaceutical way. That's exciting. The caveat here is that It takes the time and commitment that not all Americans are really built for. But Rome wasn't built in a day. If you start a regimen at the gym, it's going to take time and commitment to see the results of your hard work. It just does. Anything in regard to the musculoskeletal system is like that. It takes time. Chiropractic, massage, and acupuncture, they're no different. It would be helpful to keep this concept in mind when you're seeking treatment from either of these professionals. Your body would appreciate it, and so would those professionals. Now, chiropractors go to school for 8 years on average to achieve their doctorate degree. About 2% of chiropractors go on to extra education and testing to achieve a fellowship. I got my fellowship in neuromusculoskeletal medicine in 2019. Evidence-based chiropractors like me basically use techniques that are backed by commonly accepted guidelines and the research literature. We are typically focused on pain and getting rid of it as quickly and as cost-effectively as possible. So it makes sense that if a patient has back or neck pain, a chiropractor like me is an excellent, appropriate, and responsible first choice. Now, massage. I will begin by saying that there are multiple different styles of massage therapy. To be licensed for massage, a massage therapist must go to school, learn every little muscle and connection and how it all works together, and then pass the test to prove they retain that knowledge. Then, as it should be, many continue to learn and obtain additional certifications as they're in business longer and longer as the years go by. Now, massage is classified as manual therapy when we look for it in the research literature. And manual therapy has a ton of healing benefits. Now, that goes for the patient with musculoskeletal pain as well as those without. And what I mean here is, for example, there are suggestions that massage therapy is great for things like PTSD. That's not musculoskeletal. And blood pressure, which on the surface has little to do with pain for most people. The Mayo Clinic says the research suggests massage may be helpful for the following: anxiety, digestive disorders, fibromyalgia, headaches, insomnia-related stress, myofascial pain syndrome, soft tissue strains or injuries, sports injuries, TMJ pain, and things of that nature. Now, in talks with several patients, I've discovered that some are afraid of massages. They tell me they had one in their lifetime and it hurt, and they pretty much hated it. Now, this goes for any service. So listen, just because one or two experiences were not positive does not make it wrong for you. Okay, I need to repeat that. Okay, just because you had one or two bad experiences with a service or a discipline does not mean it is wrong for you. Can you imagine going to a family doctor and getting blood pressure medication? And let's say that particular medication didn't control your blood pressure effectively. Are you going to say that all blood pressure medications are wrong for you, you hate them, and you will never take another blood pressure medication? Of course not. That would be foolish, wouldn't it? Much in the same way that it would be silly to swear off massage, chiropractic, or acupuncture because you had one or two treatments and you weren't impressed. Sometimes it's not the discipline or the treatment or the modality, it's the practitioner. And sometimes it's just changing practitioner makes all the difference in the world. Now, I tell patients that the way to get a great massage is to communicate. Massage therapists are not typically narcissistic. They really want you to be happy. They want to do a great job because they want you to come back to them the next time you choose to get a massage. That means that for you, as well as for the therapist, communicate with them. Tell them if the pressure is too much. Tell them they don't need to be afraid to really dig in and get after it. Or tell them if it's too much pressure. There's no shame in telling them that it's too much pressure and they need to lighten up a little bit. And I promise they're going to lighten up immediately. That's the way to get a great massage that you love and that will keep you happy and eager to return. Now, when suffering neck or back pain and you feel like it's purely muscular, a massage therapist may be the best first call. Some people are more in tune with their bodies and they can really tell if their pain is purely muscular. And for these people, the decision's pretty easy. For most, though, they're not able to really determine whether there's bone or structure or movement issues mixed with muscular issues that's causing the pain. Our patients here at Creekstone, they've got the best of both worlds, since we have chiropractic and all that falls under that umbrella, as well as 5 massage therapists of all experience levels on staff here and available to them. So, best of both worlds here. Now, acupuncture. I was admittedly late for the acupuncture train, okay? But I am on board now. This is mostly due to the fact that I simply had never been exposed to acupuncture before expanding my clinic to include other professions outside of myself. As a result, I hired an excellent acupuncturist that has really allowed me to experience what acupuncture is capable of doing and has really opened my eyes. Now, I know what you're thinking because I hear it from patients all the time. You don't want to be stuck with a bunch of needles. Well, hear me out. You will not you're just not going to believe this unless you try it yourself and experience it yourself. So I'm going to try though. The needles are tiny when compared to those used to give you medicine or to draw blood. Really tiny compared to those needles. You literally don't feel them at all. Out of 30 needles or however many they put in you, you may feel a very small little twinge in 1 or 2 of them, but it's very light and it's not painful as a rule. And this is literally the least of your concerns, okay? Especially when you consider the amazing benefits of acupuncture. First, did you know that acupuncturists go to school for 4 full years to get their degree and to get licensed as an acupuncturist? This isn't a 6-month little process. These folks really know their stuff. Check this out. Johns Hopkins says that the National Institutes of Health studies have shown that acupuncture is an effective treatment alone or in combination with conventional therapies to treat the following: nausea caused by surgical anesthesia and cancer chemotherapy, dental pain after surgery, addiction, headaches, menstrual cramps, tennis elbow, fibromyalgia, myofascial pain, osteoarthritis, low back pain, carpal tunnel syndrome, and asthma. And not only that, but great research that I've studied myself has shown acupuncture is effective in treating chronic pain, anxiety, stress, tension, and PTSD. The research, in fact, has been so convincing that the Veterans Administration is now sending veterans to our clinic here in Amarillo, Texas, not only for chiropractic care, but they're also sending veterans over here now for acupuncture based on the research. And the federal government is paying for their care. That's outstanding. And I will add that our veterans absolutely love acupuncture. It's helping them sleep. And when combined with chiropractic care, it's really changed their lives. These veterans, they've been able to reduce or eliminate their pain medication. They get more quality sleep and they get active and back to being involved in their lives again. And with suicide being such a scary and public statistic with our nation's veterans, you can see the benefits of chiropractic, massage, and acupuncture. For some folks, the benefits go far beyond simple pain relief. It's about a lot more than that. And sometimes it is literally a question of life and death. And we take that very seriously. So, when asked the question of which service to recommend, I admit my bias, and chiropractic is my go-to for non-complicated musculoskeletal pain. And that goes from massage, acupuncture, surgeons, pain management, or any other practitioner, simply because I've seen the effects and benefits for over 2 decades in this profession. However, the longer answer is that I take care of the structure, the frame, if you will, while providing attention to the muscles' form and function. While massage therapists and acupuncturists focus purely on everything attached to the frame, and as we've noted, sometimes things not attached, such as PTSD, stress and anxiety, headaches even. The truth is, the best treatment comes about when practitioners combine efforts into an integrated approach to the complaint. A patient receiving care from a chiropractor, a massage therapist, as well as an acupuncturist simultaneously looks a lot like a very successful case to me. Which is the reason I chose to include all three disciplines in my clinic for a one-stop shop in healthcare for pain. It just makes sense, and we see the amazing results every day. I'd love for you to share this video and this information with your friends and family. Not everybody probably knows what you know, okay? So if you'd be so kind, share this with your friends and family. If you're watching this on YouTube, hit that subscribe button so you'll be notified when we release a new video every week. We sure do appreciate you watching. If we can help you, our number is 806-355-3000, and our website is creekstonecare.com. Until next week, be safe, take care of yourself and others.